Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Colonoscopy, we are looking at the virtual or the CT. So, in terms of the CT colonography, it is also known as the virtual colonoscopy. So, it uses the helical CT. So, it uses the helical CT. So, there is a helical CT as well as a three-dimensional reconstruction. There is a 3D reconstruction, and this is to detect the intraluminal colonic lesions. So this is used to detect the intraluminal colonic lesions. So it is the intraluminal colonic lesions. So the oral bowel preparations and the oral and the rectal contrast. So there is oral bowel preparation as well as the oral and the rectal. So it also has the oral and the rectal. So there is oral bowel preparation, there is oral and the rectal contrast, and also the colon insufflation. So also the colon insufflation. So this has to be used for the maximum sensitivity. So this is used for the max sensitivity. So let's look at the advantages here. The advantage here is it is non-invasive and the less time consuming. It is non-invasive and it is less time consuming. And the other advantage is that the sensitivity may be good as colonoscopy. The sensitivity, it may be good. So this may be good as the colonoscopy. So what is the disadvantage of this? The disadvantage is that it requires the bowel preparation. So there is bowel preparation to be done. Next is there is insensitive for the small polyps. It is insensitive to the small polyps. And there is minimal experience and data. There is minimal experience as well as the data. And the colonoscopy required is for a positive result. So there is colonoscopy. So the colonoscopy required, it is required for a positive result. So the advantages, let's recap. It is non-invasive as well as it is less time consuming. The sensitivity is good as the colonoscopy. The disadvantage is that there is a bowel preparation is required and insensitive small polyps is for the small polyps. There is minimal experience of the data. And the colonoscopy is required, that is, it amounts to the positive result. Next is the false positive results. So there can be false positive. There is false positive. So the false positive result is from the retained stool, So false positive is seen in terms of the retained stool as well as the diverticular diseases and also the haustral folds. There is the haustral folds. Next is there is motion artifacts. There is motion artifacts and the inability to detect the flat adenomas. So inability to detect the flat adenomas. To learn and grow daily like this, please do subscribe.